Hello, this is Shiny and welcome back to another episode of Thoughtful Leaders, Thoughts on Education presented by College Tech. Today we have with us Dr. Kinnari Patel ma'am, Professor and Head of Department of Oral and Maxillofacial Pathology and Microbiology, AMC Dental College and Hospital, Ahmedabad. Welcome to our show, ma'am. Yes, ma'am. Ma'am, to start this interview, I would first like to know that you say something about your department and your roles and responsibilities as an HOD.
Okay, first of all, thank you, Shiny. Regarding this department, this is basically involved in undergraduate teaching of two main subjects, dental anatomy, dental histology, and oral pathology. My role as a professor and head is divided in three parts: academic role, administrative role, as well as clinical role. Regarding academic, in UG teaching, we have to look after lectures, practical, clinical skill development, project work, interns work. Regarding administrative work, as a head of the department, too much of administrative involvement is there, and clinical work. So we receive on an average 150 biopsies every year from our oral surgery and other concerned clinical departments. So reporting of the cases is that then RBS is being done here, that is a random blood sugar estimation. So 3,000 to 4,000 patients every year is a clinical part. So that's it regarding my role.
Ma'am. Okay. So what is unique about the program of your department's offering?
Actually, my department is involved here. There is no postgraduate offering of any part, only UG teaching is there. So in a UG, dental anatomy and dental histology is there, in which we teach basic subjects. So they can learn advanced subject only, their base, their foundation is strong. So we work hard to create a strong foundation. Even the fine neuromotor skill, which is mandatory as a dentist, is taught here in our department. We are involved in a dental anatomy carvings. We teach them oral diseases, how to do differential diagnosis, and how to do final histopathological diagnosis of the diseases.
Right, ma'am. So moving to my next question, how does your department ensure the students are being prepared for the future?
See, our department, all the staff basically works hard to teach the student for the upliftment of the student, and we teach them in a way so that they can be ready for any competitive exams. Like after BDS, they have to appear in the PG NEET exam, and once they clear the PG NEET exam, then only they are able to do either PG. They can appear in they can apply for a government jobs like armed forces jobs. They consider PG merit, PG NEET merit. So we prepare them for this PG exam. Then some other courses like MSc in forensic odontology. So we also guide the student in forensic odontology if they want to pursue the career in forensic odontology.
Okay. So any challenges you faced while inculcating these courses or programs into the curriculum of your department?
Yeah, we face many challenges. Mainly, this subject is a very dry subject. We have to make the subject interesting first at all, because this is a non-clinical subject. So mostly students are interested in those subjects which they see clinical cases, right? So here our department is based on the referral practice. So basically they have to learn theory, a lot of theory, and then they can implement their knowledge practically. So we have to make the students interesting in these subjects, and that is the main challenge we face.
Right, ma'am. So how do you train yourself and faculties to deliver this program to the student?
Yes, we attend many faculty development programs. We keep pace with a newer development in the technology. We introduce many methods to make the subject interesting.
Okay, ma'am. So, what are the benefits and career options for the students after pursuing this course?
See, this is not a single course, it is actually part of a curriculum what we teach. So, after learning this dental anatomy, dental histology, and oral pathology in undergraduation, they get a degree of a BDS. So, after BDS, whatever they can do is also considered as a career option for this course.
Right. So, the type of projects that students are working on through these programs or courses.
Yes, our interns actually we give projects to our interns who are posted for 15 days during their internship program. So we usually ask them to prepare 3D models, then working models, then some natural tooth models, and they learn a lot of things from these models.
Okay, ma'am. So we have come to an end of this interview. So to end this interview, I would like to know that any advice you would like to give to current youths and aspiring students in general, also in dental.
Yes, in general as well as for a dental student, I would like to advise them to study in depth any subject, because superficial learning will not help them for a longer period. If they learn with interest, in depth, and with a precision, it will be helpful in their career forever.
Okay, ma'am. Thank you, ma'am, for your interview. Thank you from College Dunia, ma'am.